everybody. My name's Jessica. I'm a nurse here in Burlington, Vermont, where we just had a glorious winter blizzard. Actually just finished a 10-hour nursing shift. I have the privilege to be a community health nurse here in Burlington. I work in people's homes where they live, and most of the patients I see are Medicaid beneficiaries, folks on Medicare and Medicaid, or Medicare, Social Security, disability insurance. But I was coming home from work and I heard about the new Republican healthcare plan. It just got me thinking about the folks I saw today and the folks I see each week who this is really going to impact. These are people that really depend on the services of Medicaid and Medicare, that allow people like me, nurses, social workers, other people to come into their homes and provide added care that they otherwise wouldn't get. There's like all these abstract numbers and the CBO report and 24 million people losing health insurance, and that like is baffling and boggles my mind. But what boggles my mind even more is the direct impact I know that this is going to have on some of my patients that I care deeply about. I don't know if I'm just tired, but I don't get how we can be giving tax breaks to millionaires when I have patients that literally are making choices between filling their prescriptions that they need for their daily functioning and buying groceries. That to me just, how is that making America great? How is that great for anyone or anything? And so it's just a lot to think about, and you know, it's crazy because there's this big blizzard and everybody's shut in, but a lot of my patients, like, this is their reality on a daily basis. They're shut in their apartments because of immobility, psychiatric illnesses, substance abuse problems, and funding for treating all of that would be eviscerated with these new plans. And those folks are going to stay isolated. Like, this snowstorm, everybody's got cabin fever and can't get out. Like, that's the reality for some folks. And, you know, they don't necessarily have a voice in this debate. They're not on NPR, they're not on Fox News, but they're the ones that are really going to take a hit from this. I guess, I don't know, I'd love it if Donald Trump or Speaker Ryan would come explain this all to my patients, because I just really don't see how this is going to serve them. And it just feels really morally wrong and not right to me. I think we have to fight it. I think, you know, I'm tired right now, so I feel like baffled by it all, but I think if I get some sleep, I'm going to wake up tomorrow morning and I'm not going to be baffled. I'm just going to be angry. And I think that's what a lot of us need to be. I think my patients need to be angry. I think my fellow nurses need to be angry. I think people across this country need to be angry. Because this is an attack on poor people. This is an attack on the middle class. This is an attack on people's health. And they could die.